Hello everyone, and welcome to our BNF Health Eating Week 2020 presentation on Eat More Whole Grains, the first challenge of this year's Healthy Eating Week. I'm Alex White and I'm a nutrition scientist at BNF, and I'm going to be talking you through the key points of the Healthy Eating Week challenge, Eat More Whole Grains. So first of all, just a little bit of information about what BNF Health Eating Week is all about. So this year is the first year that we've run the week over 7 days. So it'll be running from the 28th of September to the 4th of October. And we'll be doing 7 BNF Health Eating Week challenges. So eat more whole grains, which is one we're going to look in a little bit more depth at today. Vary your veg, drink plenty, move more, be mind kind, get active together and eat together. Throughout the week, we're also going to be running 10 cooking sessions, which will encourage schools and workplaces and everyone to get involved in. The 2 cooking sessions that we'll be looking at Eat More Whole Grains are the Fruitalicious Apple and Berry Bars and the Moroccan Spiced Veg and Kale Salad. And we'll be giving some information on how to get involved in them later on in the presentation. For schools, there's resources, including videos, activities, games, worksheets and ideas for the week on foodeffectivelife.org.uk. And there's also lots of workplace materials, including videos and email support on nutrition.org.uk. So let's look at the Eat More Whole Grains challenge. So this year, we're encouraging everyone to have a whole grain option with at least one of your main meals every day. And one of the reasons for this is looking at whether people are eating enough fibre and encouraging them to eat more whole grains. So we're going to look today at what whole grains are, why it's important that we consume more whole grains, how many whole grains and how much are we having, and what are the barriers to intake. So why are we not eating the amount of whole grains that we want to? Why is it difficult to increase our intake of whole grains? The importance of getting enough fibre, and finally some tips on how we can eat more whole grains, and talking a bit more about the challenge itself. So first of all, what are whole grains? So there's no legal definition of whole grains at the moment, but in general, it's thought of as containing all of the essential parts and naturally occurring nutrients of the entire grain seed in their original proportions. So really what we're looking at is the whole grain food contains 3 parts. We'll look a little bit about this in a second. But really then we're saying that the refined grains, so what you might think of as white pasta, white bread, things like that, are missing some of these key parts. And we'll look at the parts in just a second. Currently, there's no university accepted definition on the amount of whole grains that should be included in a product for it to be classified as a whole grain food. However, there is an initiative to try and develop global definitions of whole grain and whole grain food. And there is a push to try and publish something on this later this year. So if we break this down into what a whole grain is, now there's a lot of complicated words on this, but really we're going to break it down into something that's more simple. So hopefully you can see there that you've got the bran, which is where there's the bits, the insoluble and solitary dietary fibre, proteins, vitamin A, things like that. Then you've got the germ, which is the bit that's the 3% down the bottom left. And then you've got the starchy endosperm. So for whole grains, they contain all of these 3 parts, the bran, the germ, and the endosperm. Whereas refined grains are missing one or more of these parts. So for an example, white flour has the bran and the germ removed. So it just has the starchy endosperm. And we'll talk a little bit about this throughout the presentation, but the real key bit to take home here is, as you can see from this long list that's contained in the bran contains most of the fibre, the vitamins and minerals. So really there are important benefits from consuming the whole of the grain and getting this extra fibre, vitamins and minerals from the bran portion. So looking at why is it important to have whole grains, we've talked a little bit about fibre already. So whole grains are a great way to increase our fibre intake. In the UK, many of us are not getting enough fibre, and fibre is important for our health, and we'll break down the importance of fibre later on. And as we said about the importance of getting this bran portion in, whole grains also provide essential vitamins and minerals. And we know that some people aren't getting enough vitamins and minerals, and certainly there are benefits to the wide range of important functions that these vitamins and minerals have in our body. So when we look at the research into whole grain foods, people who tend to have an increased intake and higher intakes of whole grain foods have a reduced risk of certain diseases. Now, some examples of this are cardiovascular disease, type 2 diabetes, and colorectal cancer. And the graph on the right here shows the number of deaths at the global level attributable to diet. And as you can see right at the top is a diet high in sodium, and then second down is a diet low in whole grains. And that's up there with things like a diet low in fruit, vegetables, nuts, and seeds. So certainly whole grain foods are a really important part of the diet and really important for our health. So why is it that whole grains are so important? We talked a little bit about the importance of having the bran with the increased amount of fibre, vitamins and minerals. And we talked a little bit about this death from all causes, and incidence of coronary heart disease, type 2 diabetes and colorectal cancer were lower in those that consumed the highest amounts of whole grains compared to the lowest. But it's also important to look at the fact that that in these foods, it's really these higher amounts that really make the difference. So whilst the refined varieties do contain some fibre and vitamins and minerals, it's really looking at these higher amounts, and that again is due to the bran. And this is why we think that this may explain the health promoting properties of whole grain foods. So what counts as whole grain food? Well, a few examples are here, and we'll give a few more as we go throughout the presentation. But wholemeal or whole grain breads are an example, whole wheat pasta, brown rice, whole grain breakfast cereals, porridge oats, and then sort of the ones that you might not be as familiar with, things like bulgur wheat, spelt, freekeh, or quinoa. When we're going shopping for whole grain foods, it's sometimes not always easy identifying which food is whole grain. So if we're able to look out for the words whole grain, wholemeal, and whole wheat on the ingredients list, then this can help us make sure that we're choosing whole grain foods when we go shopping. So how can we fit whole grains into our diet? Well, one of the really good things about whole grain foods is that they can fit into both our main meals, but also in snacks. And we should be making sure that when we're making choices and trying to choose healthier options, especially with starchy food, we should be looking at these whole grain or higher fibre varieties. Now, this is a resource on nutrition.org.uk, the Adult Weekly Meal Plan, that gives some examples of how we can include lots of whole grains and higher fibre options in our diet to try and meet the fibre recommendations of 30 grams per day. And some examples of what we can have for breakfast. Got an example here of brown flakes, trying to choose wholemeal bread when opting for bread. So with things like beans and toast or scrambled eggs on toast. Porridge can count, and again, as with the dried fruit on the bran cereal, it's a great way to include some of your 5 a day, and then things like Weetabix, which have a considerable amount of fibre in them as well. Whole grain lunch options, example here of quinoa salad, again a type of pasta salad. In the middle, again, salad's a great option to get lots of your fruit and vegetables in, and then the example on the far side is choosing wholemeal bread with spinach and avocado. So again, the wholemeal option with some of your 5 a day as well. And then dinner options, using brown risotto rice or wholemeal brown rice as a dinner option. Whole wheat spaghetti or pasta is a great option, and then barley as well. You can use that as a replacement, as with quinoa, as a replacement for rice or pasta if you want to sort of increase some variety and make some healthy swaps. And then with the whole grain snack options, these types of foods are really good. And one of the things to note with popcorn is trying to opt for unsweetened plain popcorn as opposed to the other options that you might opt for. So how much whole grain food are we having? So it's important to recognise straight away that there's no UK dietary reference value for whole grains. Having said that, just for a reference, for when we're looking at the median intakes of whole grain in the UK, the US recommendations are to have at least 3 16-gram servings of whole grain foods per day. Now, if we compare this to the actual UK intakes, what we're having is 20 grams per day for adults and 13 grams per day for children and teenagers. Now, it's important that we say here that there's actually not that much data on whole grain consumption in the UK, but this analysis has been carried out on the National Diet and Nutrition Survey data, so it can provide us estimates for how much whole grain food the average people in the UK are having. One of the really important things to recognise here as well is that those from a lower socioeconomic status are consuming significantly less whole grain food compared to those from more advantaged backgrounds. But overall, what we're seeing is a significant proportion of the whole grain foods that are being consumed are from whole grain breads. So you can see there 44% in adults and 35% in children, and in breakfast cereals. So 27% of the whole grain intake in adults is made up of breakfast cereals, and that's 36% in children. When we say about there not being any recommendations, these are really the recommendations from the Eat Well Guide, the government's healthy eating model. If we are choosing starchy foods, which should make up around a third of the diet, to choose whole grain and higher fibre versions. And at BNF, we've done some work looking at portion sizes. We've produced a guide which suggests the average portion sizes for different foods for healthy adults. And these are some of the examples for whole grain foods. So for the breakfast cereals, around 40 grams, 45 grams of dried weight for porridge, 80 grams, which is 2 slices of wholemeal bread, 180 grams for brown rice and for wholemeal pasta or spaghetti. You can find out some more information here on our website, the Find Your Balance, Get Portion Wise guidance. And this gives the full list of portion sizes, not just for whole grain foods, but for all the different foods that you'll be likely to consume. And the other interesting thing that there is in here is what's called a handy guide. So it's the fact that you can use your hands to estimate portion sizes. So if you're tired of sort of keep weighing out amounts of food, and some great information about how you can use your hands to estimate portion sizes. What we've also seen is there's been a decline in consumption of starchy food. So as we said, the Eat Well Guide recommends that food from the potatoes, bread, rice, pasta, and other starchy carbohydrates food group should make up just over a third of our diet. But data from the Family Food Survey, which looks at household food purchases, shows that these types of food only make up around a fifth of the diet. What we've seen over the past 50 years or so is there's been a reduction in the purchasing of some staple foods such as bread and potatoes. And this is shown quite well here. So the family food data that goes back a little bit further than this showed that 30% of household energy intake on bread was in 1945, and that this was only 11% in 2014. And what this graph shows is from slightly more recently, from 1974 to 2018, we've seen that there's been this gradual decline in bread consumption and bread purchasing. So as you can see, this fall has been generally attributable to the decline in white bread. And if you can see, the line with the triangle on it is the brown and wholemeal bread. This has actually stayed relatively consistent. It's sort of increased slightly in the mid to late 80s. But then what we've seen over this time period is that the difference in purchasing between white bread and the brown and wholemeal bread has actually reduced over time. So the amount of white bread and the amount of brown and wholemeal bread has become a lot closer in the last 30 years or so, 30, 40 years. But what we've seen overall is a general trend in bread consumption declining over this time. And these are data from the Family Food Survey, which has shown that we've seen this slight decrease in fibre intake. Now, this may be attributable to a few different things that we'll look at a bit later, but certainly one of these is the decline in wholemeal bread intake and bread intake overall, but also things like fruit and vegetable intake is going to be intrinsically linked to our mean fibre intake as well. So what is it that's making us not consume the whole grains that we should be? I think a lot of people will feel that whole grain foods in general are quite healthy, and many might know the recommendations that we should be having more, but there are some barriers to increasing the whole grain intake. First one is around confusion about how much to consume. So hopefully the information from the portion size guidance will help slightly with this. I think this is slightly linked to this negative perceptions about starchy carbohydrates. So especially in the media, we see this narrative that carbohydrate makes you fat. We should be trying to either cut carbs or certainly drastically reduce carbs, and this push for the low carbohydrate diets. So I think this does add some confusion to consumers about whether we should be increasing our intake of whole grain carbohydrates because they're carbohydrates, and this risk towards weight gain. So I think this kind of confusion from the media can make it difficult for consumers. There's this lack of knowledge about how to cook whole grain food. People aren't sure whether it should be cooked in the same way or whether you can replace like for like with refined carbohydrates and whole grain carbohydrates. There's also this acceptance of the sensory properties, and I think this is a really important one. So people don't like the taste or the texture, especially if it's something different than they've had before. And one of the ways to try and combat this, if people are having barriers to this 100% whole grain options, is there may be options to try and use things like 50-50 breads, where part of the grains are whole grain, and to use these as sort of transitional foods. So this can offset some of the difficulty with the taste and the texture of moving from refined grains directly to whole grain. But certainly that is one of the big barriers to whole grain intake. And then there's also this confusion around which foods contain whole grains and how they're beneficial for health. So people might hear that, oh, we should be consuming more whole grains, but might not be sure why and exactly which foods this includes. There's also a barrier to do with the convenience of buying food for a family, as an example. So in low-income households, we see that people buy one type of bread that everyone will eat to avoid food waste. So if we go back to the acceptance of the sensory properties, if one person in the family doesn't like the taste of whole grain bread, as an example, or pasta or rice or whatever it may be, then it might be that they say, oh, well, we're not going to eat it, and families, to avoid food waste, to avoid buying multiple types of bread, will just go, oh no, we won't have that at the moment. So we'll move on to the importance of fibre. And as we've mentioned previously, when we talked about the bran and the reasons why we should be going for whole grain foods, fibre is really essential to this. So if you look at the recommendations, adults in the UK should be looking to have 30 grams of fibre per day. But actually what we're seeing is they're having around 19 grams per day on average. And really the reasons why fibre and diets high in fibre are so important is there's this link between diets high in fibre and a reduced risk of heart disease, type 2 diabetes and colorectal cancer. And we also see a link between fibre and our digestive health, fullness, and a decrease in constipation. It's not just whole grain foods that contain fibre. So if we're looking to increase fibre overall, increasing the amount of fruit and vegetables, pulses, nuts and seeds are going to be really important. But if we're looking straight at this Eat More Whole Grains challenge, whole grain foods, higher fibre breakfast cereals are going to be really, really important in meeting our fibre recommendations. And if we break this down a little bit more, we can see that the age group 19 to 64 years, so this adult age group and the 19 grams per day, this is actually lower than the recommendations for the age group 4 to 10 years. And as you can see, in all of the age groups that are shown in this data from the National Diet and Nutrition Survey, mean intakes are far below the dietary recommendations set out by the Scientific Advisory Committee on Nutrition. And there might be a lot of different reasons for this. We talked a little bit about the barriers, but two of the big ones are going to be looking at fruit and vegetable intake and whole grain intake. So only 31% of adults and 8% of teenagers meet the 5 a day requirements, 5 a day of fruit and vegetables, and 18% of adults and 15% of children have no whole grain consumption. So that's the one that's really linked to this challenge. And if we look at the fact that fibre reduces disease risk, it's really linked to cardiovascular disease, coronary heart disease, type 2 diabetes, colorectal cancer, and stroke risk. And this is what was laid out in the 2015 Scientific Advisory Committee on Nutrition, SACN report, Carbohydrates and Health. And actually, the recommendations from this paper, or from this report, changed the recommendations in the UK. So the recommendations of fibre actually increased to 30 grams per day following this publication. When we look at fibre, the other really important aspect to look at is looking at the variety of fibre. So the recommendations are that fibre intake should be achieved through a variety of food sources. So trying to have types of fibre that span across the Eat Well guide. So it's really going to be from the fruit and vegetables and the potatoes, bread, rice, pasta, and other starchy carbohydrates group, and whole grains and higher fibre food are going to be a really important component of that. Most of the evidence that we see about the wide range of benefits from fibre comes from studies where dietary fibre intakes are achieved through consuming a variety of rich fibre foods. So it's really important to look at a variety and make sure that the fibre is coming from lots of different sources. And if we look here about the importance of these whole grain options to do with fibre intakes, we can see it in this table. So the fibre content per portion of the refined varieties compared with the whole grain varieties. As you can see, there's quite a stark difference between the two. So for breakfast cereal, as an example, 1.1 grams in the refined variety, increasing to 5.4 grams. For bread, the white toast, 2.4 grams, the wholemeal toast, 6.6. You can see a similar increase for the other food. And I think this really shows well how much this increase in fibre can be. And if we're seeing the 19 grams per day that the mean adult is having, compared with the recommendations of 30 grams per day, as soon as you start making these kind of healthier whole grain swaps, we can really see the difference, and we can start breaking down that real large at the moment difference between the 19 grams per day and the 30 grams per day. So trying to make these healthier swaps is going to be a really important component of meeting these requirements. And there's a few resources on nutrition.org.uk about the importance of fibre. So this is the Fun Way to Fibre resource about how you can make these healthier swaps. The diet on the left, 13.1 grams of fibre, and the diet on the right, 42.5 grams. We've got the adult weekly meal plan, which we discussed earlier. And then there's also this Fibre Up Your Life resource. So some top tips on how you can increase your fibre in your life, but also fibre up your barbecue, fibre up your salad. So these are some really great resources if you're trying to look at how to increase the amount of fibre in your diet. And there's some interesting further reading as well. These are two of the papers from Nutrition Bulletin that have been cited throughout the presentation. But you can learn a bit more about the role of bread in the UK diet. And there's bits in there about the whole grain bread, and also the challenge of increasing whole grain intake in the UK. So when we looked at the barriers, that's from that paper, and there's some really interesting information in there as well. So how can you get involved in the Eat More Whole Grains challenge? Well, there's the poster and the challenge guide here, which we really encourage everyone to print out, whether they're working from home or whether they're working in the office or whether they're in school. Put these up around wherever you're working, There's the seven Healthy Eating Week Challenge posters and the 7 challenge guides. If you're in school, there's lots of idea sheets. This is an example of one of the ones for primary. So some information about the worksheets, resources, activities, games that are available, and then some tips on how to use the challenge to promote having more whole grains at your school. So there's a few examples there. And then we really encourage everyone, as with every year, to get involved on Twitter. So if you're a school and want to show us what you're getting up to, then please tweet at Food Effective Life. And if you're a workplace getting involved in the week, then tweeting at BNF events. And here are some of the examples from last year of schools getting involved in the week. And this year we're using the hashtag BNFHEW20. So yeah, we really enjoy seeing what everyone's up to on Twitter. And then again, we really encourage everyone to get involved in our BNF Healthy Eating Week cooking sessions. As I said, there's going to be 10 running across the week, and the 2 Eat More Whole Grain sessions are the Fruitalicious apple and berry bars and the Moroccan spiced veg and kale salad. These will be available on the Food Effective Life YouTube channel, and will be available during the week and after the week. And for more information about Healthy Eating Week, if you want to find out about Healthy Eating Week in schools, with all the general support and the challenge guides, posters, challenge videos, resources and activities, then you can go to foodeffectivelife.org.uk and look at the BNF Healthy Eating Week page. For workplaces, there's loads of information again at nutrition.org.uk/healthyliving/HEW. And then if you want to find out more about the BNF Healthy Eating Week cooking sessions, if you click on the Get Cooking tab on Food Effective Life, and you can find out all the recipes and the recipe videos that will be running throughout the week. So I'd like to thank everyone for listening, and we really hope that you enjoy BNF Healthy Eating Week 2020. Get as involved as you can with all the challenges, and we hope you have a fantastic week. Thank you very much.